Good evening and welcome to the Pompey Politics Podcast.
I'm Ian Tiny Morris.
And I'm Simon Sansbury.
Well, time flies when you're having fun, Simon, doesn't it? Last pod of November, and after this one, only a couple of more weeks left in the autumn-winter season before Christmas is upon us.
It is indeed, yeah. We are, as you say, at the end of the month, and we're in the penultimate month of the year that seems to whiz past in a bit of like a blur between February and August. And things are maybe going backwards a little bit, aren't they?
Well, and I guess that's the fundamental question we'll look to address this evening, which is, as our thoughts turn towards Christmas and the countdown is 4 weeks today, it'll be Boxing Day, and if all is well, you and I will probably be around your dad's house drinking his excellent port, and that's what we're all hoping for. Well, obviously, many people aren't hoping about our port consumption, but I'm sure we are. But the question, I guess, is the new variant of the COVID virus going to put paid to that? And both of us have made a complete hash of naming it, I think, in various ways, but I believe it's the Omicron variant that
I think
has.
isn't it Omicron?
Is it Omicron? Oh, good God. Well,
To me,
we're just sticking in random letters and.
Well, they're just going for random kind of Greek letters from the Greek alphabet, or they are just stealing all the good baddie names from series of Doctor Who. So Chris Chibnall is hurriedly renaming all the people in the next season of Doctor Who.
Almost certainly. So the Omicron version that has originated in South Africa started popping up earlier in the week, and then the question, I guess, is: has the government acted quickly enough? Is it going far enough? Or is it again a case of seeing the horse headed off into the middle distance and thinking, better do something with that stable door?
Wow, that was a bit Alan Bennett. So
I
yeah,
could have done that
it
full
does.
Alan Bennett. Or is it a case of the government looking at the horse heading off into the distance, as I said to Thora Hurd as I bolted the stable door?
Okay, yeah. Sorry, listeners. Maybe we'll ask Ian not to do that. But yeah, don't worry. We'll be nowhere near a microphone after consuming the port. So yeah, I guess the kind of whole thing. If we cast our minds back to last year, it was all the government and the prime minister saying, "I'm going to save Christmas from the scientists. Actually, have people round. It'll be a normal Christmas. You could do this. Oh, actually, no, sorry. But actually, you've only got a couple of days now. So it's
Can I just say, for the record, having had a bit of a pop at my Alan Bennett,
yeah,
then rolling out your very own Boris Johnson, I think if there's an impersonation rap battle, old son, I won that one hands down. But no,
I
your
think
point
you
is
did.
valid.
But yeah,
The whole let's save Christmas. We're going to have a normal Christmas, which those of us at the time who kind of been watching these things looked at it and went, I don't think you are, and so it came to pass. So we're 4 weeks out now, and
yes, well, the measures that the PM announced yesterday were, and he did make a bit of a Peppa Pig's ear of it, were that that basically from Tuesday there's a slew of countries in Africa that have been added to the red list. So only people from the UK and Ireland that are returning from those countries are actually going to be allowed in. Anyone else is actually banned transit from coming from those countries, and you would need to be able to pass you'd have to pass a PCR test in order to come out of self-isolation. So
I
there's
don't
those.
think that I don't think that's quite correct.
Oh,
I believe for those countries, anyone coming in from the red list countries who are, and you're right, it's only UK nationals that can return. I believe they have to go into a mandatory 10-day quarantine. I think in terms of anybody returning from any other overseas destination will be required from Tuesday to do a PCR test on the second day they get back, and are, we'll use the word required in air quotes, to self-isolate until they get back the negative response.
So sorry, you're right. So passengers from UK and Irish residents returning from those countries have to stay in a quarantine hotel
Yep.
for 11 nights. But passengers from other countries will have to take a COVID test before takeoff unless they are double vaccinated, but they need to complete a PCR test on the 2nd and 8th day of arrival and isolate for 10 days if unvaccinated. Although they can pay to have a test on day 5, which ends their quarantine if it's negative. So that's actually the current measure.
Yeah, I think the and again the one that, as with all of these measures, the piece I think that worries me is that, if you've had your 2 weeks in winter sun in the Canary Islands and you're flying back and you're landing on Wednesday morning and you've arranged to be back at work on Thursday, are you actually then going to take the additional 2 days holiday on Thursday and Friday, take your PCR test, hope that the result comes back over the weekend so that you can go back to work on Monday? Or are you going to, I don't know, take a lateral flow? I don't know. My worry is always with these measures, it's about compliance and what do you do? How do you ensure that the measure you're putting in place actually is followed?
Yes, but the PM has gone on repeatedly previously on trusting in common sense and in people doing the right thing. In any large group of people, there will always sadly be people that believe that rules don't apply to them. Yeah, if only there weren't so many examples of those in government, I guess. But it's yeah, I guess that's the kind of question. But one of the things that was then sort of teased, a bit of a spoiler in the announcement from the PM yesterday, but he ended up confirming it in the answers that he gave to the journalists that were assembled at number 10, and someone tweeted it from his Twitter, was basically that face masks in shops and public transports will also be mandatory unless you're exempt from Tuesday. So yes, but I hear that that Sage had been perhaps actually suggesting that returning to the suggestion of work from home if you can would have also been the greatest possible impact on the potential spread of Omicron, but that the government decided not to proceed with at this time. But they'll be reviewing these measures in 3 weeks, right? Which will be just as you said earlier on, just 7 days before Christmas.
Before Christmas, exactly that. And I guess when I look at it and look, we all know that this is a very nuanced discussion, and often on social media, nuance is very much lost. So there is an element of, I want to frame this within any precautionary measures we take are good precautionary measures. So there's an element of wearing a face mask in an indoor setting, sanitizing your hands, looking to respect people's personal space and social distancing. All of that stuff is really helpful. I think the thing that I'm kind of, that worries me about what's been announced this week is it a path of least resistance for the government to announce the measures which they think people won't mind too much?
Possibly. I mean, looking at the examples of how they've approached it previously, it does seem that that actually what they've decided to do is to do the thing that they think is going to cause the less furore that people will kind of go for. But by hesitating that much, it then actually inevitably means that they have to do eventually be dragged to doing something harsher and more sterner at a later date than actually if they just actually were more decisive and were more robust in the actions that they take at an earlier point. I mean, as an example, the other three the three countries of the UK. So to be fair, this kind of conversation is about the rules in England, because in Scotland, Northern Ireland, and Wales, they never removed the requirement to continue to wear a face mask in public enclosed spaces and on public transport. And so in that kind of respect, as much as they don't really, I think most of them pragmatically have decided that from a control measures of travel coming into their respective countries, because they're part of the UK, their ability to kind of control their borders is diminished by them being part of the common travel area and being part of the UK. So decided effectively by the UK government. So it would be impractical to have a different travel set of circumstances in what vastly a different set of travel circumstances in Scotland than it would be in England, because no one's going to erect an actual physical border between Scotland and England. But let's not get diverted by that one. There's a whole kind of different question there. But so from a perspective of, it seems that kind of England has kind of trailed behind a bit. So from a perspective of actually what will happen about the infection spread in the respective elements of the UK, bearing in mind that some have had mask wearing in public continuously and some haven't, have those in England then been exposed and therefore allowed greater community spread, which may or may not be to the benefit if it means that actually people have built up a natural immunity. And of course there's the whole kind of rollout of boosters, which, although there's a question mark about whether Omicron will diminish the effectiveness of the vaccines will still be massively effective in reducing spread and in reducing the severity of the health outcome concerns of people that get infected. So it's, to be fair, it's an unfolding situation, but it feels again like we're playing catch up.
Yeah, and I think there is an element of if we look at the whole mask thing. If I just give you an example, is that so the organisation I work for, whilst they've got limited people coming back to offices, our policy is still that if you're in an indoor space and you're in a work setting, you wear a face mask. Now, over the last month, I've attended some face-to-face meetings and some training, and they were all at the old-fashioned conference-style venue. So we as an organisation turned up and we all wore face masks whilst trolling about inside the venue. We were the only people to be wearing a face mask. It was literally, and again, I had colleagues from Scotland who were like, well, this is weird. Actually just seeing people indoors without face masks is just alien. You just don't do it. And one of them had come down on the train and had said, well, it's weird because everybody who got on in Edinburgh all got on with a mask. And the second the train got to Newcastle, which was its first stop in England, everybody who got on the train didn't wear a mask, literally to a person. And she said it just felt so odd that, on that one journey, you could just see that difference between the two approaches.
Yeah. Sorry, I didn't mean to interrupt you.
No, I think that the piece which if I look at, which worries me about the trying to put the masks back on Tuesday, is for the vast majority of people, they've just got out of the habit of doing it.
I think a lot have, but to me, despite the practicalities of reminding people to do it, or the concerns that some people won't do it, doing it isn't a difficult thing to do, obviously, no. Unless you're medically exempt. So I think that people will get back into the habit. It's just the question of, it would have been nicer to see a clearer message on that. And indeed, one of the journalists actually asked the PM, are you imploring people really kind of firmly to follow the mandatory mask wearing. And I don't know whether that was a lead into the concerns about those images a couple of weeks ago about the PM going around a hospital not wearing a mask himself, but from a perspective of there was a real opportunity there for him to say to the country, yes, actually, we all need to do this. We all need to make sure that by protecting each other, reducing communal spread, that we wear these face coverings in order to help each other be just that bit safer. And it's just these little things. There's no one thing that will eradicate COVID. There's no one thing that will make it impossible for people to catch it, unless you're like in an airtight container with your own oxygen supply, I guess. But you take a list of measures to kind of help you, and those are the common, those things aren't unfamiliar to us. Like you say, we've just got out the habit. So those things are the wearing of a face covering in enclosed public spaces, unless you're exempt, the hand sanitization, the social distancing, which wasn't included in the instructions that were discussed yesterday, and nor was, for example, requirements to wear them in restaurants and things like that. So in that sort of space, there also wasn't talked about the requirement to demonstrate a vaccine passport, which is required in other parts of the country.
Well, and I think here you touch on the piece that one of the many pieces that worries me is that the Prime Minister has clearly been setting out his stall since the pandemic started as a libertarian. Well, I'm not going to tell you what to do. I'm just going to rely on your good nature and your British sense of pluck to do the right thing. Well, that's not good enough, and that's why this worries me, because there's an element of, and I shared this example on social media today. If I look at my day yesterday, I did go into a shop and I did pop the mask on for the 10 minutes I was in there. I was good and compliant. Then I went to the rugby club, and whilst I know you are not an expert in the field of rugby football, you know that it involves two groups of men getting fairly close to each other. It's a physical contact sport. So there was six.
Sounds like my kind of thing, but go on.
Anyway, indeed, yes. So the 70-old chaps running into each other yesterday, and me stood in the freezing cold. And I got too cold, so I went to the bar to warm up, as is the tradition in rugby circles.
For medicinal reasons.
For medicinal reasons. So those 70 chaps who have been in close proximity are now in the bar with me, and there's now 100 of us, 150 people in the bar. And we're all having a jolly good chat and a natter, and we're taking a beer, and there isn't a face mask inside. And so we then finished our beer and all headed off home. And I look at that, and that'll be okay next Saturday.
Yeah, and I mean, with any rules, there will be inconsistencies, but there is a kind of glaringly obvious one, isn't it? Is that, and that kind of comes back to the fundamental questions of, should the government have to be spoon feeding people to make those decisions? And the truth is that although some people might actually quite well conclude that those sorts of things should be avoided, or indeed the organisers should kind of look at the risk of infection spread within such a close confined space with so many people, and make alternative arrangements. But unless the government mandate it, there will always be people that think that that's not an issue.
Well, I think it goes further than that, because if we look at the unlocking, the last place that the government unlocked was nightclubs, wasn't it?
Mm-hmm.
Because they knew that the definition of a nightclub would be full of people breathing on each other in close proximity. And in terms of that was you didn't have to be a skilled virologist to know that was the highest risk scenario, which is why it was the last to unlock. And so, and this is where this whole libertarian angle really worries me, in that, well, we're not actually prepared to deal with that, or we're not going to put sanctions back on nightclubs, which means that people are going to, quote unquote, think it's safe because, well, if it weren't safe, then the government will shut it down like they did last time.
Yeah, I mean, indeed. I mean, to be fair, I mean, Lynn in the comments has said that it, and I quote, "It looks to me like we're saving the economy at the expense of the people," and that the PM had skirted the issue. So, you know, it's kind of clear to some that that there is a lack of decisiveness and leadership, and whether that whether that causes problems further down the line, I guess only time will tell. It's early days for Omicron. We don't quite know how much more infectious it is, if at all, than any of the other variants. We don't know how much more serious it is than the other variants. There just isn't the data yet. But we're kind of in a learning curve. But we've got some learnings that we had from last year, from late last year, and actually from early last year. We're in a better situation in many ways. We know what sorts of measures we can put in place. We know now how to manage those and how to put them in place. We also know what the issues with some of them are, because of the rapid changes that had to be made to some of them that were instigated at very, very short notice. We've obviously got vaccinations, including boosters now, and the government talking about talking about putting I think the words the PM used was boosting the booster program. So in that respect, we've got tools in our arsenal now that we didn't have last year. So maybe we don't quite need to react how we missed out last year. But I am still a bit worried that we are going to make similar mistakes again that we could have learned from.
Well, I guess the question for me, and this is or the key part here, is that this variant is worrying us enough to change our behaviours, to put control measures back in place. If you can just bear with me just 1 second, I have a dog to attend to, which I know shouldn't happen in a podcast.
Okay, so while Ian sorts out his guide dog, who has suddenly decided that they want to go to the loo, so yeah, the concern would be: is the government doing enough? Is it reacting too slowly? Is it reacting too? Is it doing too little, too late? Again, sadly, we'll only kind of find out in about 3 weeks' time whether actually this turns out to have been too little, too late, and actually something kind of harsher needs to be kind of stomping down on it at that point. It does certainly feel, I kind of understand that, to some degree, you could observe that it feels like the PM's doing what he can to save the golden quarter of the Christmas shopping period. But is that the right thing to do for the country? Obviously, the businesses that have struggled for the last 2 years are really, really dependent on this time of year for people to be shopping. But if suddenly people are more hesitant to go out again, or there are more restrictions that they need to put in place that cost them measures to put in place, it's an unideal world, and you have to put in place less than ideal solutions, because you have to put in place what you can, but do something. It's that, I think that for me, that seems to be kind of the obvious call out as the cat comes backwards and forwards across the screen.
Yes, Enid Blyton has come to join me now, so all of my animals are attempting to wreck my ability to broadcast this podcast in a sensible and informed way.
Okay, but despite evidence to the contrary, Ian doesn't actually live in an animal shelter.
No.
But there we go.
Yeah. So I think for me that the bit that concerns me is the fact that the only measures we've taken are the ones that are easy and are non-controversial. We could have added the work from home if you can to that, which for me is a missed opportunity, because it just. But again, it's that balance that we talk about, isn't it? Of all those, all of those local, or that infrastructure around, people who went to work in offices, and that infrastructure has been under pressure because, people just don't go to offices anymore. And again, I was back at our head office on Thursday, and it's only as I walked in that I realised that the noble Tim no longer exists, who was the one man person that ran the little sandwich shop and coffee vending service at our head offices. And the answer is, well, what happened to Tim? Well, Tim's gone, and although we're back with the head office open, there's probably 20% of the people there that worked there before.
Yeah, I mean, there are places that are either kind of splitting their work week between home and
Yep.
the office. There are places that haven't returned to the office, so indeed now need considerably less floor space. So if there are shops or concession units or whatever, whether they're attached to a particular office or they're independent of them, that there just isn't the footfall that there used to be to sustain them. But that does mean that there are people around actually in the places where they live. So that does that's obviously bad news for the for the franchisees, for example, of large coffee chains in the centre of cities.
Yep.
But it's good news for the corner shop down the road from us, because if that means that, okay, I'm going to break time, I wander down the road and get a packet of crisps or whatever. So it's again, only time will tell. But again, while you have to consider the economic impacts, people that are hospitalised or worse don't spend any money. So
no, and I think that is the key piece, and the worry for me is that even with such modest measures proposed, the ridiculous the number of people who I would consider to be reasonably sane and sensible, who've shared things from, well, I won't be having my booster again then. I don't understand what the point this is if I'm just going to be repressed and locked down, and the tyrannical will abuse my nature as a freeborn Englishman. And you just say, oh, for God's sake, really? Really?
Yeah. And that kind of brings us to a nice segue, talking about, so obviously we are, even if Omicron does diminish the effectiveness of the vaccines, they're still wildly much more effective than not having a vaccine.
Yep.
That's no reason to to avoid them. So so in our extensive research for this evening, we looked at vaccine hesitancy, and one of the points that I think it was Gary had put out when we'd shared on Facebook in the Portsmouth Politics group about the episode that we were going to do today, was the question of what's vaccine hesitancy like in the NHS, for example, compared to the rest of the country. What's that actually like overall? Is that a cause for concern? And you'll be interested to know that I did some delving off of two different data sets. So there were some sets of information from the ons.gov.uk for England, and some information about NHS in a study that was done by the Lancet. And those sets of information said that actually broadly, and I'm going to pop this on screen for those of us following live, but I'll talk through it for those of us listening for the podcast afterwards. So broadly, actually, overall, England vaccine hesitancy is about 4% of the population that's entitled to it. But vaccine hesitancy in the NHS is about 22-23%.
And that was a wow moment for me. 4%, I guess. And forgive me here, I am not going to walk a neutral line. I am not going to be balanced in my opinion. I know that might surprise some. So I can get that 4% of the population are stupid, and I can accept that, because statistically that seems reasonable. But 22% of 3 million workers.
Yeah,
really?
and really, and more shockingly, as you break down the information, the information is stratified in both sets of data to ethnic groupings. So in mixed race groupings, in England, that's 7%, and in the NHS 34. For people from an Asian background, that's 6% England and 24 in the NHS. For Black groups, that's 21% in England and 40% in the NHS. And there weren't any figures for England for other ethnic groups, but there was data captured for 28. But to be fair, the some of this data is actually really kind of small sample sizes with regards to those kind of those groups. But the information from the Lancet is actually data taken from a survey of 11,500 healthcare workers. So it's that's quite considerable. But it's easy to be drawn by the percentages in those particular ethnic groupings. But when you look at the England-wide stats, the number of so even though hesitancy amongst the white population is actually 4%, the number of they only contribute 4% of the hesitancy overall of that survey sample, which I think was about 15,000 people, whereas actually all of the non-white groups only contributed to 0.5%. Sorry, their vaccine hesitancy only represented 0.5% of the overall sample size in total. So it says certain things about how that kind of plays out in particular ethnic communities. But actually, overall, obviously the largest number of people that are vaccine hesitant is the white population, because they are the largest size of the population.
Yeah, I think the general hesitancy data is kind of, and I think that that when you look at that through the lens, it does. The worry there is that there is an overrepresentation from non-white ethnic groups in the hospitalisation and death figures, and the worry is that whilst that remains the case, the fact that there is a higher rate of hesitancy within those communities, continues to be a kind of real worry, and that messaging, you can't afford to stop. But the NHS numbers, they're just terrifying.
Yeah, indeed. And there's some further breakdown in the information from the Lancet. They talked about actually what the reasons for that hesitancy was, and some of that is, to be honest, is quite eye-opening. So distrust leading to vaccine hesitancy amongst NHS healthcare workers. The concerns raised were about the speed of vaccine development, the efficacy and safety of vaccines in general, mistrust of the healthcare organisation due to prior unethical research practices, lack of representation and inclusion of ethnic minorities in trials, and institutional racism and discrimination. So it kind of speaks to a lot of wider systemic issues, as to, even if you feel unable to trust the information that your own employer, and your employer is in the business of trying to keep people healthy, if you feel that you're unable to trust the information that your own employer is giving to you and giving to the public, that says lots of things, and none of them good.
Yeah, but it does say some bad things, but it also just says, for me, it just screams bad understanding of data. That's the bit that, and bear in mind, I've got a little bit of a background in this. When they talk about unethical healthcare practices, every major pharmaceutical company in the world, if you go back through their history, you will find an example of where they have done something unethical and they've received eye-watering fines for doing it. So you'll find that in every healthcare, but for the vast majority of those, they were 30, 40 years ago. There are not that many modern examples. And if you look at the way in which the research was done on these particular vaccines, almost all of it was done on open platform sharing sites where all the scientists in all the pharma companies in the world effectively collaborated to so that sort of that I don't know that they probably fiddled the results mindset. It just I struggle to understand why the layman would think that, why somebody who works in healthcare might think that. It's mind numbing.
Yeah, and indeed, when you look at the NHS data, when you drill that down to hesitancy amongst particular types of roles in the NHS, that actually gives you some interesting figures. So, 28.2% of nurses, nursing assistants, midwives were vaccine hesitant. 23.9% allied health professionals, 21.7% admin, estates or other roles, 21.1% dental, but 18.4% of doctors and medical support staff were vaccine hesitant.
That's nearly 1 in 5 doctors. You've gone to bloody college to learn about this stuff, and oh dear God.
So to me, the qualitative data that was behind this study in the Lancet was speaking to the particular comments that that NHS professionals had kind of given, but they do kind of constantly speak about the issues that we kind of talked about earlier about trusting. How can we trust clinicians when we know that they're not following guidance? How do we know what rules to follow when the messages are changing and often contradictory? We're overwhelmed with the amount of information. There's a lack of information in other languages, a lack of trust and confusion around hesitancy. There's stigma around it, which makes it difficult then for people to feel that they can approach someone to help inform them. Distrust around the risks not being communicated transparently, and about a lack of prioritization given to ethnic minorities in studies, given that they suffer disproportionately higher chances of worse health outcomes. And ethnic minority communities being singled out in messaging and media, adding to a feeling of stigmatization, a lack of direct engagement to address and respond to issues or concerns, and the language used around groups and stereotyping, speaking to the stigmatization, and just a lack of transparency around the decision making. So it kind of, to be honest, that creates an impression of an environment where trust is very, 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 very thin on the ground.
It does. It does. But again, I still can't. I guess I'm finding this whole kind of segment just baffling, because I just don't understand how somebody who is educated and knowledgeable, who has the ability to understand the science and the data, can't get over their own nervousness to do, the phrase "do your own research" has been weaponized. But if anybody was in a position to understand the bloody research and the data, it would be people from a medical background. And if you looked at it, the evidence is absolutely overwhelming. And particularly, when you saw back in the pre-vaccine, ICU wards overflowing with people dying of the thing, and now post-vaccine, you're seeing a completely different dynamic. Surely that should be just enough to make you go, there must be something in this.
You'd think, but to me, I mean, obviously I'm not on the front line of the NHS. I don't know what it's really like to work there, and obviously that will be a broad and differing experience depending on which part of it you work in, how the trust that you're what the trust that you're working at is run like. So I guess in any kind of large organization, you're going to have you'd have a fair number of people that would be distrusting of the strategic or specific decisions actually made by the people in positions of power to make those decisions. But maybe we're just kind of thinking that that sort of level of distrust from upper management, from the front line of the upper management and the strategic decisions made wouldn't apply to the NHS. And sadly, this kind of says otherwise. I mean, from the ONS England wide data, so not just NHS, but basically people across England. The reasons that people gave for vaccine hesitancy. 54% said that they're worried about long-term effects on their health. 58% said that they're worried about the side effects of the vaccine. 55, I think the vaccine's been developed too quickly. 45%, I'm waiting to see how well the vaccine works out. 30, it was good of them to use the rest of us as guinea pigs, I guess.
Yeah, no,
30,
it's lovely to know that I'm part of a study.
But I mean, in that respect, that's kind of like sound scientific process, right? You see how it works out to kind of do. But nonetheless, 34% don't feel that I'm at risk because I'm in good health, and 29% I think other measures are enough to keep me safe, i.e., face covering, social distancing, and washing hands. There's kind of like
that's the only bit I'm going to forgive people for,
right?
Because there is an element of, if you're a 20-something and you're in good health, and you eat well, you live right, you've not got any of those underlying conditions, you don't smoke, you're not overweight, you don't drink too much. If you are that person, then objectively the risk to you as an individual is low. You're probably going to get it, and you're probably going to get away with it fine. Statistically, that's the truth. So those bits, I guess, and maybe that's where I might, but I don't see, if we looked at those numbers again and the demographic was skewed, that actually the majority of vaccine hesitancy was coming from those under 30 in the NHS, I guess I could start to understand that a little bit better.
Well, there were some interesting call outs at. I mean, I haven't got stratification figures on it, but the study in the Lancet called out that some things were increased the chances that someone was much more likely to be vaccine hesitant if they were younger, if they were female, and that may have been skewed by about 63% of respondents that said that they were pregnant, said that they were vaccine hesitant. But at the time the study was done, the clinical advice was not to get the vaccine if you're pregnant. So that may have kind of affected those sorts of figures.
Yeah.
If you score high, so some of the questions were about, basically how on kind of like a sliding scale, how much do you believe COVID-19 conspiracy theories? Those that had a higher propensity to believe COVID conspiracy theories, those who had a systemic lower trust in their employer, and those that didn't take the 2020 flu vaccine, all seem to be indicators of an increased likelihood to be vaccine hesitant. So again, it kind of speaks to this thing about misinformation, thing about distrust, and I mean, that's quite alarming in a profession that you'd think actually would be quite switched on about this, but maybe we're doing them a disservice by applying different rules to them than we are kind of thinking. I'm no disrespect to porters, but I bet they don't get a chance to stop and ask doctors random questions about how vaccines work during the course of their day.
True.
Maybe kind of that's the that's kind of a thing there. But it's just an interesting thing about there was more done about what measures could be put in place that would convince someone to decide to forego their vaccine hesitancy.
Well, and I think that's got to be absolutely the key, hasn't it? Because if we look at it, we've mandated for care home workers. We're now mandating for NHS staff. We know there are staff shortages within the NHS, but again, that tends to be at the more clinical end. Doctors, nurses, midwives. So it'll be very interesting to see whether mandating the vaccine, there's two schools of thought that says if you mandate vaccine, mandatory vaccination, that only hardens the stance of the libertarian. But I guess for some, it may be a case of, well, I don't really want the vaccine, but I can't really afford and don't want to lose my job, so stick it in my arm.
There's an interesting so one of the conclusions that was drawn in the study, so this is the study again in the Lancet, was that and this was reported before mandatory vaccination in the NHS was on the cards. So whilst mandatory vaccination and these measures may improve vaccine uptake, our results indicate that implementation of these policies may undermine trust in the healthcare organisation, and vaccination hesitancy would not be seen equally across. The vaccine program would not be seen equally across ethnic groups, and such interventions have a potential to increase the stigma and discrimination and widen ethnic disparities. So it's
but I don't.
again
No,
that
I don't.
would
No, I'm not having this.
okay.
Because ultimately, and this is where, for me, when you get into these areas, that there is a certain nervousness. The stigma and there's almost, well, you can't force people. I don't accept this. I just don't accept it. The vaccine is an offer. And as I think you've pointed out many times, you get vaccinated for basically to protect yourself, to protect your loved ones, and to protect the people that you don't know. It is a threefold reason for doing it. So there is an element of I kind of I don't support, but I accept if for your own selfish reasons you don't feel you need it to protect you. I can even extend that out to, you kind of think your loved ones will be all right if you don't do it. But what I can't accept is that in a care setting in the NHS, you think it's okay to gamble with the health of the people you don't know who you care for. So I don't care what your reasons are for being vaccine hesitant. That is between you and your God. But if you're there to look after vulnerable people, you don't get the right to choose whether you're going to put them at risk.
I'm, to be fair, I don't know that I disagree on that point, but I think it's, this is just what the Lancet study is saying and what they're calling out. I think there's an opportunity there to engage with and assure people in a way that will help resolve their concerns. There's in any large and in any organization as large as the NHS, there's always going to be someone that who you can't convince, who is determined not to change their mind. I mean, we've experienced enough people that we've talked to over the 100+ episodes that we do this, that sometimes there are people whose mind isn't open to reason or change, some for valid reasons and some not, but nonetheless it's it's a worthwhile effort, and it's incumbent on any employer to do what they can to resolve any concerns that employees might have about their treatment in the workplace. And if someone was, in any setting, if someone, if where I work, someone was expressing concerns about vaccine hesitation, as much as it would be tempting trying to resolve those, I'm not a clinician, I'm not a virologist, I'm not a doctor. I'd advise them to go speak to theirs, which admittedly isn't necessarily that easy, but I'd advise them to speak to someone that knows what they're talking about, because they may have, beside the fear and the rubbish that they see on Facebook, or my uncle's daughter's nephew's dog put this YouTube video out, there may be something actually underlying that's actually behind that fear that can actually be resolved. But that's something that perhaps professionals should be doing it instead of amateur podcast hosts. But
and I'm good. Let's educate, and I'm good for educate before we legislate. But Oh, that's a slogan. We might use that later. But there's an element of for me, we're past that now, and we're at that
Well, we
point.
definitely are in care home settings. The question
Yes,
is, if the government are talking about putting in place by April the same measure for frontline NHS staff, there's an opportunity between now and then to to forgive the phrase, to win that engagement war.
yep,
To actually deal with it. And this report gives clues about how the government or healthcare trusts might perhaps actually go about that. But you remember when we said about there were things that would convince people that were vaccine hesitant to forego their hesitancy and just get
yes,
jabbed
indeed.
anyway. I haven't got
Yes,
like a game show noise
I was going to
because
say,
I didn't want
oh,
to actually make it sound that fun. So there are 6 different answers to this. Okay, 2 of them are 13%, 2 of them are 16%, and 2 of them are 19%.
oh,
Okay, and here are the answers. So I was vaccine hesitant, but I would get the jab if it helps restrictions to ease and life to return to normal. Where do you think that would go?
oh. I think that's in the middle.
Okay.
16%.
Okay. I'd forgo my vaccine hesitancy if I was offered vouchers or discounts. I think they did this in the States, didn't they?
Oh yeah,
They
yeah, yeah,
offered
yeah,
people money to go get a jab.
yeah, yeah. I'm I'm going to say that people are selfish. I'm going to put that in the 19%.
Okay. If my employer told me that I needed to be vaccinated for work.
Yeah, that's in the top. I reckon that's the top one.
Okay. To protect myself from the coronavirus.
13%.
To protect others from the coronavirus.
16%.
And to make it easier for me to go on holiday abroad.
13%.
Okay. Now I'll reveal to everyone else at home. So if my employer told me that I needed to be vaccinated to work, 13%.
No.
Vouchers or discounts, 13%. If it helps restrictions to ease and life to return to normal, 16%. You were right on that one. To make it easier for me to go on holiday abroad, that's 16%. And to protect myself from the coronavirus and to protect others from the coronavirus, both of those were 19%. You got one of those right.
Just. But it's an episode of incredulity for me because those top two at 19%. That's what the vaccine does. Well, I'd
Yes.
definitely have it if it did what it does. Well, it does that. Oh, maybe I'll have it then. It's like a 70s sketch show, this.
Just without the cheap, thinly veiled racism or homophobic or misogynistic gags.
Oh, yeah.
So,
no, we don't do those anymore.
No, we don't. No. So another part of the ONS study that's on the gov.uk website also talks about people that, so they've done different sets of collecting data actually over the course of the last year. And what they did is they talked to the group of people that had previously said that they were vaccine hesitant, and they split them into 3 different groups. So this is where you get some good news. So 42% of them have said that they were unsure about getting the vaccine. 33% said they were unlikely to get the vaccine. And 25% have outright declined. They're not going to get the vaccine.
Yep.
Okay. Now, of the 42% that were unsure, 60% of those actually went on to get vaccinated.
Oh, this is encouraging news.
And 38% of them are still unvaccinated. Of the 33% that said that they were unlikely to get vaccinated, I feel like they should have like a higher or lower. 40% have gone on to get vaccinated, and 59%. Do excuse if any of these don't add up to 100 because of rounding
Yeah,
rounding
none of them
stuff.
do, but that's fine.
59% of them are still unvaccinated. Okay.
Yep.
And of the 25% of the overall, I'm the vaccine
Yep.
hesitant group from the previous data set, 21% have gone on to get vaccinated. So the ones that have declined a vaccine outright,
You're not getting that in my arm.
right? And 78% of those are still unvaccinated.
So it's encouraging, I guess, that 1 in 5 of the most stupid are now vaccinated.
You know what we said about stigma earlier on?
No. I told you I wasn't going to be balanced about this. For me,
Okay.
if you refuse to get vaccinated, you are thicker than a whale omelette. I'm not pulling any punches on this. I am not taking a mediation ground on it. So I mean, in broad terms, 1 in 5 of the most have crossed the line. I guess 40%. So that's what? That's 2 in. Yeah, I'm quite encouraged by those figures. That there is hope that the old you can't educate pork is an old adage, but it would seem that actually if you try really hard you can.
So wasn't going to make any links to Peppa Pig World. So yes, so of that group of people that previously were listed as vaccine hesitant, 44% have actually gone on to be vaccinated, and 55% are still unvaccinated.
Yeah, and I guess if that's,
like you said, there's hope.
There is hope. There is hope there because, ultimately, as you said, as you 1923. You said yourself, you perfectly summed it up. There is no magic bullet. One thing is not going to, quote unquote, save us from COVID. And I think it's clear, and I think anyone who knew a little or a lot knew that at some point a variation would appear from part of the third world that was going to give us some bother. That was a given.
It was. I mean, obviously there were conversations about whether strategically the better thing to do would be to donate or support poorer countries in order to get vaccinations started and done in their countries, rather than racing to a 90% plus vaccination rate in our own countries, because unless we're all safe, unless all of us are safe, none of us are safe, because there is all the time there is a partially vaccinated population, there will be a chance for contagion, and the more infections that there are, the greater the likelihood there is of mutation and then spread. That if the virus discovers a way, I guess that's how the evolutionary. You'll tell me this is how the evolutionary nature of viruses kind of work. Is that they'll effectively random mutations occur. Some of them are really successful, and then that's why you have these variations kind of popping up. So that's kind of another broad question. I did have some figures on that, but I won't bore you with those at this point.
Yeah, no, and I think look, as we go into the run into Christmas, that we do all, whilst I don't agree with the Prime Minister's, well, we all need to do our bit, but I'm not going to tell you what your bit is that you need to do. We all have personal responsibility, and we can be sensible about these things. And look, I'm still hopeful of supping your dad's and my father-in-law's port on Boxing Day, and whilst that's not the most important thing in the world, I guess that represents not our new normal, but our old normal for Christmas. And my fingers are crossed that we're still going to get a chance.
Hopefully so. I mean, if not, Ian, you appear to have dropped off the call. I don't know whether the cat has stood on something, because the cat was sat in front of the computer. But whether that means that we have to, that we end up meeting in their garden to do that. I mean, Paul isn't very good in the garden, but I'm sure we can find a way to get around that. We're industrious and inventive. So just before we go, as we say, we've got 2 more shows this year. So our last show of the year is going to be December the 12th. So we've got an open schedule for the next 2 shows at the moment. If you've got any ideas or anything that you would like us to cover in those 2 shows, by all means, please do email us, pompeypoliticspodcast@gmail.com, or contact us through our Facebook page, or contact us via Twitter. And We'd love to hear from you. But in the meantime, please do keep safe of yourself and of each other. And Ian has just sent me a message to say that the cat has indeed logged him out of the transmission. So I will wrap up the show. I've been Simon Sansby. You've been listening to the Pompey Politics podcast. Good night.